Hello, my desk guardians. Today we will talk about a very important topic of radiology, which is reading chest X-ray. It will be comprising of various other topics like diseases diagnosed by chest X-ray, which organs can be seen in chest X-ray, and benefits and risk of chest X-ray along with chest X-ray reading steps. First of all, we will see what is chest X-ray. Chest X-ray is a film which produces images of heart, lungs, airways, blood vessels, and bones of spine and chest. Conventional X-rays shows white bones and black background because X-ray radiations are less likely to penetrate in denser materials. Darkest parts of film like lungs are areas and have more photons which can penetrate the body, while bright white bones are denser materials and lack photons. Now we will see what are some common uses of X-ray procedures. Usually in any surgical emergency or diagnosing any disease, physicians recommend X-ray as first monitoring test. Usually it is performed in breathing difficulty, bad or persistent cough, chest pain or injury, or fever. Physicians use the examination to help diagnosis or monitor treatment for pneumonia, heart failure, and other heart problems, emphysema, lung cancer, positioning of medical devices, fluid or air collection around lungs, which will be discussed in this topic one by one. Now we will come towards reading of chest X-ray films. Firstly, we will make a list of table of contents and discuss them one by one with X-ray films. Table of contents are 4, which are confirmed details, assess image quality, A, B, C, D, E approach, and lastly review areas. So firstly begin chest X-ray interpretation by checking following details: patient detail, name, date of birth and unique identification number, date and time the film was taken, and previous imaging for comparison, as we do during chest tube intubation to see chest tube location and recovery session. Next, you should assess the quality of image. With mnemonic you may find useful is RIPE. First R is for rotation. The medial aspect of each clavicle should be equidistant from spinous process, and spinous processes should be in vertically oriented against vertebral bodies. I for inspiration, which means 5 to 6 anterior ribs along with apices, both costophrenic angles and lateral rib edges should be visible. P is for projection, which means film is AP view or PA view. If there is no label, then assume that it's PA film. If scapula are not projected within chest, then confirmed PA view. E is for exposure. The left hemidiaphragm should be visible to spine and vertebra should be visible behind the heart. Now we will discuss third and major step of chest X-ray reading, which is A, B, C, D, E approach. The A, B, C, D and E approach can be used to carry out structural interpretations of X-ray. A is for airway, comprising of trachea, carina, bronchi and hilar structures. B for breathing, comprising of lungs and pleura. C stands for cardiac, comprising of heart size and its borders. D stands for diaphragm, including assessment of costophrenic angles. E stands for everything else, comprising of mediastinal contours, bones, soft tissues, tubes, valves, pacemaker and review areas. Now we will see A, B, C, D and E one by one in detail. Airway contains trachea, firstly, which is located centrally or deviating very slightly towards the right. If trachea appears deviating, inspect anything that could be pushing or pulling the trachea. Make sure to inspect for any paratracheal masses or lymphadenopathy. True tracheal deviation is due to large pleural effusion or tension of pneumothorax causing pushing of trachea, while pulling of trachea is due to consolidation with associated lobar collapse. Second checkpoint in airways carina and bronchi. Carina is cartilage situated at point at which trachea divides in left and right main bronchus. Right main bronchus is usually wider, shorter and more vertical than left main bronchus. In result of this difference in size and orientation, it is more common for inhaled foreign object to become lodged in right main bronchus. Depending upon quality of chest X-ray, you may be able to see main bronchi branching into further subdivisions. Third and last checkpoint of airway is hilar structures. Hilar consist of main pulmonary vasculature and major bronchi. Each hilar also has collection of lymph nodes which is not usually visible in healthy individuals. Hilar are usually of same size, so any asymmetry should raise suspicion of pathology. Hilar enlargement caused by sarcoidosis and underlying malignancies. Second step of ABCDE of chest X-ray is B, which is for breathing, and one should check lungs and pleura. Firstly, check lungs. Divide the lungs in 3 zones, each occupying 1/3 of height of lung. These zones do not equate lung lobe because left lung has 3 zones but 2 lobes. Check lung markings and compare each zone of lungs. Some asymmetry is normal and can be present by anatomical structures like heart, stomach, and liver lobe. Increased airspace shadowing in a given area of lung field may indicate any pathology like consolidation or malignant lesions. Completely absence of lung markings should raise suspicion of pneumothorax. Then check pleura for abnormalities which is not usually visible in healthy people, and if pleura is visible, it indicates pleural thickening associated with mesothelioma. Fluid or blood can accumulate in pleural space, causing increased opacity of chest X-ray in hydrothorax and hemothorax. In some cases, combination of air and fluid accumulate in pleural space, hydropneumothorax, resulting in mixed pattern of both increased and decreased opacity of pleural cavity. Third step of chest X-ray ABCDE is C for cardiac, comprising of heart size and its borders. In healthy person, heart should occupy no more than 50% of thoracic width. This rule only apply in PA chest X-rays, and if heart occupies more than 50% in PA chest X-ray, then it leads towards cardiomegaly, which can occur due to wide range of reasons including cardiomyopathy, pulmonary hypertension, and pericardial effusion. Now if we talk about borders of heart, then the right atrium makes up most of heart borders and left ventricle makes most of left half of heart border. Heart borders may become more difficult to distinguish from lung fields as a result of pathology which increases opacity of overlying lung tissues. Reduced definition of right heart border associated with right middle lobe consolidation, and reduced definition of left heart border is typically associated with lingular consolidation. Fourth step of reading chest X-ray ABCDE is D, which comprises of diaphragm. Right hemidiaphragm in most cases higher than left in healthy individuals due to presence of the liver. The stomach underlines left hemidiaphragm and is best identified by gastric bubbles located within it. The diaphragm should be indistinguishable from underlying liver in healthy individuals on erect chest X-ray. However, in free gases present often as a result of bowel perforation, it accumulates air under diaphragm, causing it to lift and become visibly separated from the liver. If you see gas under diaphragm, you should seek urgent senior review for further imaging because it can be pseudo-pneumoperitoneum, which include Chilaiditi's syndrome, which involve abnormal position of colon between liver and diaphragm, resulting appearance of free gas under diaphragm. As a junior doctor, you should always discuss a scan of free gas to senior colleagues immediately. In healthy individuals, costophrenic angle should be clearly visible during diaphragm examination of chest X-ray. Because loss of acute angle sometimes refer to fluid or consolidation, to that area. Last step of ABCDE of chest X-ray is E, which shows everything else which is remained behind, including mediastinal contours containing heart, great vessels, lymphoid tissues, and number of potential spaces where pathology can develop. Aortic knuckle is located at left lateral edge of aorta, and reduced definition of aortic knuckle contours can occur in context of aneurysm. Aortopulmonary window is space between arch of aorta and pulmonary arteries. This can be lost as a result of mediastinal lymphadenopathy. Inspect visible skeletal structures and fractures. Inspect soft tissues for obvious abnormalities and large hematoma. Nasogastric tubes placement is something you will ask to assess on chest X-ray to confirm safe placement of feeding tube. Various tubes and cables will be visible on radio-opaque lines such as ECG cables and central lines. Some artificial valves such as aortic valve replacement and some pacemakers can also be seen through chest X-ray examination. Finally, before completing your assessment of chest X-ray, make sure you have looked at review areas where pathology can be missing, like lung apices, retrocardiac regions behind diaphragm, peripheral region of lungs, and hilar regions. This ensures you have comprehensively accused X-ray and reduced risk of missing subtle pathology. Now you can revise all table of contents for quick memory, and lastly we will discuss some benefits and risks of X-ray radiations. Benefits of X-ray includes no radiation may stay in your body after X-ray exam and do not have any side effect if supervised by an expert. X-ray equipment is usually inexpensive and easily available in doctors' offices, emergency rooms, ambulatory care centers, and making it convenient for doctors and patients. Because of fast and easy approach, it is preferred as first-hand emergency diagnosis and treatment. Now we will see some risk factors of X-rays. There is always a slight chance of cancer from excessive exposure to radiations. Radiation dose varies for different procedures and it can affect fetus, so pregnant ladies should tell their doctor or X-ray technologist before X-ray examination. So this was all about chest X-ray reading and diseases which can be pointed out from chest X-ray examination. See you all in some other video. Till then, take care.